अस्सलाम वालेकुम, आई एम डॉक्टर समर। A lot of you asked me blockage कैसे start होती है. So let me tell you about one patient. I call her Mrs. A. So Mrs. A, she is 60. Few months back she started feeling tired. Not normal tired's. Climbing stairs would make her breathe heavy. She thought age हो रही है, normal है, but then she noticed chest heaviness. Not pain exactly. Like someone sitting on her chest for 2 and 3 minutes, especially when she is walked fast or got stressed. Then it would go away with rest. Now hear what actually happening. Her heart, arteries, think of them like water pipes, they were getting narrow. Why? Over years, cholesterol, BP, maybe sugar and stress. They make blocks stick to the wall. Slowly the pipe gets blocked. At first 30% and 40% you feel nothing. But when it crossed 70%, blood flow got low. That's when symptoms start. One day she had acidity type burning. Left arm felt heavy. She ignored it for 2 days. Third day the heaviness came back stronger and didn't go. That when family rushed her to ER, ECG, top T test and angiography. So we found 90% blockage in one main arteries. We did an angioplasty, put a stent. She fine, alhamdulillah, but the listen, blockage doesn't happen in one day. Body gives signals, breathlessness, chest heaviness, jaw pain, unusual tiredness. Don't call it gas or age every time. If it comes with activity and goes with rest, get it checked. Thank you for watching.